Good morning, everyone, and thank you so much for coming to another presentation from our Health Ministries department here at Kansas Seventh-day Adventist Church, supporting a healthy lifestyle. Today, we have a great topic. It's October, it's Breast Cancer Month. And so, our presentation today will be on breast cancer awareness. It's such an important topic to our ladies here and our men. You know, there is breast cancer in men as well. And so we will be hearing from Dr. Olongo regarding breast cancer awareness. Let me start with a word of prayer. Father God, thank you so much for bringing us all here today. Please be with this presentation, with our technical difficulties, be with everyone under the sound of my voice. Please add a special blessing to everyone that we will be able to understand what Dr. Olongo is saying, that we will take and add it to our lives, her presentation. In Jesus' name I pray, amen. So let me introduce Dr. Olongo. She's been with us before, and so we're so happy to have her back. And unfortunately, I just lost my intro, but she is a board certified um, OBGYN. And so she graduated here at Loma Linda University, and she is working and practicing in Bakersfield, California. So let's go ahead and welcome Dr. Jacqueline Olongo.
Good morning, and thank you for having me once again, Kansas Avenue, and all the people on the internet out there. And this month is October, and so we know it's Breast Cancer Awareness Month. And I'm just trying to get my screen a little bit larger.
No
And
problem.
can you see?
Yeah,
I'm
let
sorry
me.
about this. Okay, there we are. Thank you. Okay. So, with this being Breast Cancer Awareness Month, breast cancer affects all of us, men and women. There are over 3.1 million cancer survivors in the US, and with technology and with lots of information and research, the survival rate has actually gone up. So, with breast cancer, let's talk about what the breast tissue is made up of so that way we can be informed as to what to ask our doctor if that diagnosis comes up. So the breast tissue is made up of ducts and lobes. So there are about 15 to 20 lobes, and then they break down into lobules, and then they attach to little tubes that are called ducts. And so when women have cancer, it's either usually lobular cancer or ductal cancer. In addition to the lobes and ducts, you also have lymph nodes. You can see the little green circular oval shaped objects on this picture, and they drain infections and disease, and you can find them along the side of your breast as well as by your collarbone or clavicle. So as I mentioned before, ductal and lobular cancer are the main cancers that happen. Ductal cancer is the most common form, and it occurs in 1 in 5 of all newly diagnosed breast cancer patients. Lobular cancer is less often found. It, however, if it's found, is often in both breasts. Another type of breast cancer is inflammatory breast cancer. It is rare and it is aggressive. And the last one is carcinoma in situ. In situ is actually a good diagnosis because it's localized, it hasn't spread anywhere. With inflammatory breast cancer, things to know, well, the main thing to know is that there's no palpable lump. So, breast cancer facts continued. The leading risk factor is being a woman. The next one is getting older. As we get older, things change and break down in our body. So, being a woman and aging. Hereditary breast cancers only make up about 5 to 10% of the cases. The most common form of hereditary breast cancer comes with the BRCA1 or BRCA2 mutations. You may also hear them referred to as BRCA1 or BRCA2. So, as we mentioned before, inherited risk. So the BRCA1 and BRCA2 are the more common of the mutations, but there's also one called CHEK2, CHEK2. So women with these mutations are usually diagnosed at a younger age. With the BRCA1 mutation, if it happens, you may often hear the term triple negative. These are also associated with an increased risk of ovarian cancer, pancreatic cancer, and prostate cancer. So if men in the family have this mutation, they also have to be on the lookout for these other forms of cancer that may affect them. The BRCA2 mutation is associated with an increased risk of ovarian cancer, melanoma, pancreatic cancer, and prostate cancer. So once again, a mutation in a male family member can also affect him. So HER2 stands for human epidermal growth factor 2, and HER2 is just a protein that's found on the surface of all breast cells, and it is involved in normal cell growth. In some individuals who have breast cancer, there's an increased incidence of them because there's a mutation that causes extra protein production. For a woman who's HER2 positive, they'll have a high level of this protein, as mentioned before, because of the mutation that makes extra protein on their cells. And when a woman is HER2 positive, the type of treatment that they have is targeted for that type of breast cancer. As mentioned before, you may hear the term triple negative, and this means that your tumor receptors are negative for estrogen, progesterone, and the HER2 marker. This type of breast cancer often occurs in younger women. It is more aggressive and it's more common in African American women. For breast cancer in non-Hispanic white women, it actually occurs more often, but unfortunately, in the African American community, when it happens usually before age 40. And no matter what age we are, we often, unfortunately, are at more risk for dying from breast cancer. So, what can you control? You cannot control who your parents are and what your genes are made up of, but you can check your breasts regularly. You can abstain from alcohol. Maintaining a healthy weight also improves your chances of not getting breast cancer. Breastfeeding, if you're able to, and speaking with your doctor about screening for genetic mutations, especially for people who have multiple family members with breast cancer. For the self breast exam, so you can perform this at home, you can do it standing or laying down. When you do the breast exam, you don't need to just focus on finding lumps. You also need to notice skin changes. So it's encouraged for a woman to stand with her arms over her head and facing the mirror, or hands on the hips and leaning forward. Sometimes with certain tumors, they cause puckering of the skin or retraction behind the wall, so it looks like you have a little dent. For some women, the breast tissue may look like an orange peel. And for some women, they may notice a red scaly patch. And that red scaly patch can be associated with infiltrative um, breast cancer, which is the aggressive one that does not come with a palpable lump. So, as I mentioned before about putting your elbows on your hips and checking your skin for skin changes and check for superficial lumps as well. You can also lay flat on your back and raise your arms over your head. And you want to use your fingers, these fingers, you don't want to just press with your palms because your fingertips are actually more sensitive. You're also going to check for your lymph nodes, like you saw in the picture in the beginning. You need to check under your arms and up by your shoulder blade, and also check for nipple discharge. Be aware that all nipple discharge is not cancerous, but nipple discharge that was not there before does need to be evaluated by your doctor. Signs and symptoms. Well, there's feeling a lump, there's a change in breast size or shape in a non breastfeeding woman, dimpling or puckering of the skin, as mentioned before, nipple discharge, the scaly red, dark, or swollen skin, swollen or enlarged lymph nodes. So, things I can't control. Like I said, you can't control your family's history of cancer. You can't control elevated lifetime estrogen exposure. So what does that mean? For some people, they try their best and they're not able to lose weight. So the extra adipose or fat cells that we carry increase our exposure to estrogen because that tissue makes extra estrogen, especially after menopause. It's still functioning to make estrogen. Another thing that you can't control is dense breast tissue. So what does that mean? So when you do a mammogram, dense breast tissue, uh, dense breast tissue appears white. Abnormalities also appear white. So if you were to have a mammogram that showed dense breast tissue, your gynecologist or family practice doctor would recommend or should recommend that you have a follow-up ultrasound to be able to see past the dense tissue to see if there are any cystic or solid masses in there. So, as mentioned before, having an ability to maintain a healthy weight will help to decrease your risk. You, if you've had radiation in the past, this does increase your risk, and consuming alcohol does increase your risk. So, speaking about the mammogram, so it's recommended that you start having mammograms regularly starting at age 40. Some some health organizations say every 2 years after 40, and some say every year. Either one is fine. Just please get your mammograms done starting at age 40. If you do have a family member who was diagnosed with breast cancer before the age of 50, so if your sister was diagnosed at age 43, then technically you would actually have to start doing your mammograms 10 years before the youngest person was diagnosed. So you would start at age 33 because it takes several years for the breast cancer to develop. So you're looking to try and catch it before it becomes an aggressive um, metastatic breast cancer. Okay. Sometimes when you go for your mammogram, not all the time actually, I should say, you're told to avoid using deodorant. The reason is in deodorants or antiperspirants, I should say, they have aluminum, and aluminum is metal, and the flecks of aluminum may show up as white. Calcifications that are that can be seen as abnormalities on a mammogram also show up as little white flecks. So that's why you're asked not to use antiperspirant deodorant on the day of your mammogram. So let's go through some myths. A mammogram can cause breast cancer to spread. That is not true. The mammogram is just putting pressure on your tissue. It is not spreading the cancer. And some people think that eating healthy will cause breast cancer not to affect them. So eating healthy does help to decrease your chance of having breast cancer, but once again, your number one risk factor is being a woman and getting older. So breast cancer can affect any of us. And this is something that's commonly asked as far as antiperspirants, deodorants, and hair dye can cause breast cancer, or can they cause breast cancer? And the research says that no, there's no evidence that they are linked with causing breast cancer. And breast cancer can always cause a lump that I can feel. As mentioned before, infiltrative breast cancer presents as a skin change, not as a lump. And men can also get breast cancer. And so for men, yes, most of the time it's less frequent because they don't have as much breast tissue as women. But men can get breast cancer. So if a man were to feel a lump, he should actually go and be evaluated by his doctor for further evaluation. So, menopausal hormone replacement therapy. How does it affect your breast cancer risk? So, the research out there with the Women's Health Initiative says that the combination of estrogen and progesterone together over time can increase your risk of having breast cancer. So, long term use of hormone replacement therapy after menopause should be, I guess, should be should not be encouraged. Make an endpoint, take it, and then see if you can wean off of it and see how well you can tolerate your symptoms or see if your symptoms are gone after a certain time. For women who are just taking estrogen therapy, the research says that your risk isn't significantly increased. So for women who've had their hysterectomy already and they're taking the estrogen for their hormone replacement, your risk is not as high as the one who's taking the estrogen and progesterone. And now the floor is open for questions.
Thank you so much, Dr. Longo, for your presentation. That was very informative. I especially like the part of going through the myths. You know, we have so many myths regarding getting our mammograms done and breast cancer risk, especially amongst the African American community, but worldwide as well.
Yes.
And so I was very happy to see you address those, and especially regarding the deodorant. You know,
Yes.
people often ask that one, right?
Yes.
And I did not know how to answer them regarding that.
Yeah.
So that is great to hear about what actually happens when we wear our deodorants to the mammogram screenings.
Right.
And so, folks, feel free to put in any comments, any questions that you may have so that we can go through them. We have a few questions, but before I get to those, I want to welcome our participants. Our first participant was Judy, so we welcome you and thank you so much for supporting a healthy lifestyle here. And so we have a question from the comments here about, and she says, why are more African Americans at risk for dying from breast cancer?
Okay, so it's multifactorial. Uh, Number one, from my clinical practice, for some people, they're just scared and they don't want to get the mammogram because they're
Mm-hmm.
concerned about the radiation exposure. So
Mm-hmm.
that's one. So then by the time it's found, it's gotten more aggressive because there is an inherent distrust of the system. Okay. Another reason maybe many of us are carrying more weight. So breast tissue is made up of fat, and so you have heavier, larger breasts, and so then it may be something that's not found until later as far as palpating and checking yourself. And there, it's such a complicated question, and there honestly isn't a good answer.
Mm-hmm.
Some people believe that there's a stress factor involved, and so when they're just in general, because there's so many healthcare issues that affect us differently than they affect other people. Or
Mm-hmm.
once a person comes from the Caribbean or Africa, their risk after a generation goes up to an African American's status. And
Mm-hmm.
so that's why the stress factor in this society, I think, has a strong component to do with it. But then also, like I said, the distrust and not seeking care sooner rather than later, that may be an issue. And sometimes
Yeah.
just not being informed because some people feel that they're fine and
Mm-hmm.
they don't show up until 45, 50 for their mammogram.
Mm-hmm.
Just like with colonoscopies, there's so many people who just put it off because it's not pleasant.
Exactly. Not a pleasant experience. Everybody's afraid of the breast pain
Right.
with the mammogram,
Mammogram.
right? Yes. And so you were mentioning there about weight. So is
Yes.
obesity a risk factor then for breast
Yes,
cancer?
it is.
Oh, wow.
It is.
Is that just based on our hormones? We have more hormones with obesity or?
Yes. So adipose cells, which is a doctor term for fat cells, which we all have. If anyone has ever cleaned chicken or prepped it for consumption and taken off the skin, that's what we all look like. Like when we cut into anyone's tissue, there's a layer of fat. So extra adipose cells make make estrogen. It helps to synthesize it. Estrogen is an estrogen is a fat-based hormone that your body makes. Testosterone, estrogen, progesterone, they're made from fat. And so you have basically lots of building blocks for it. And so you increase your risk
Oh,
of getting,
wow.
yeah,
So as we're overweight, then the
yes.
more we weigh, the more estrogen we make, the more the side effects.
Yes. So, for
Oh, dear.
example, even for uterine cancer, the heavier you are, the more risk
Mhm.
you are of getting uterine cancer
Oh, wow.
because that that extra estrogen that your peripheral cells, so like out here, not just the ovaries, are stimulating the lining of your uterus.
Oh, my goodness. And then off the topic, but I was just curious then, is that another indicator why we would get more fibroids then?
That's another complicated.
That's okay.
So, no. So with fibroids, there are theories out there. So many theories are based on the type of food that people eat that are triggering the more
Mhm.
common. I mean, it's to be so common in our population.
Mhm.
Yeah,
Oh, okay. So while we're on food, then we do have a question here from KR Rebuild asking what diet will help us minimize our breast cancer risk,
a plant-based diet, plant-based whole food. Sorry, because yeah, plant-based
right?
whole food. So
Because
because
French fries are a
correct,
flat,
yes,
which I would go for, right?
right. And
But correct me now. Mhm.
Oreos are vegan, and so people would think, okay, I'm just not going to eat any. No, plant-based whole food because you get the antioxidants from the food, you get the fiber, which helps to clear unwanted fats. It's just, yeah, plant-based whole food.
So plant-based whole food. So we should be having our vegetables every day.
Yes,
Uh, that will bind. I believe it binds somewhat with
fiber.
our fiber, right?
Yes.
And so that will help lower our risk then.
So a cheat
Um,
that I tell people for my
mhm,
patients when they come in for their annuals, just to encourage them to do cheats, do something better than they did last year. You can
mhm,
do smooth. So the S is smoothies, stir fries, salads, and soups. So the stir fry, you don't have to use the oil per se. You can use vegetable broth to
mhm.
minimize the oil product. And for the smoothies, make sure you have vegetables in there, mostly, because if you're just otherwise you're having fruit candy. But
Right.
but basically, smoothies, stir fries, salads, and soups, minimum 2 of those a day, and that will get you on track to eating more fiber.
Oh wow, that's a great way to remember all the S's, right?
Yes. Mhm.
So and then the stir fry, that sounds really good since we need about 4 cups. Is it 4 to 6 cups of
Five,
vegetables
five
a
to
day?
seven, five to
Five.
seven servings minimum of
Oh
fruits and
wow,
vegetables a day.
a day. Now, is there a particular food that helps, particular with breast cancer? Like I heard about soy, soybeans, tofu.
No, that soy is more for soy can help you with your hot flashes and will help you with protein intake. But
Mm,
for you would I would say for the most part, if you were to go to Google and type in healthy antioxidants. So basically, you'd find blueberries, you'd find walnuts, things like that. If you type it in, you'll get a list of things that you can eat, and you pick from that list of healthy antioxidant type foods that will help to promote your good health.
mm.
Because when I tell people, why don't you eat blueberries and blah, 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 and then I'll hear, oh, I don't like blueberries. Oh, I don't like spinach. Okay, go to Google, just type it in, and you pick from that list. Make that your grocery list.
Excellent, excellent. So definitely eating our soy will help with the hot flashes for those of us who are running through that
Yes.
right now. And then, so one of the questions here is also, is the breast cancer screening, the mammo recommendations different for African Americans and Hispanics, seeing as how they have a higher incidence of more, I would say,
Death.
death?
So no, the screening is not different. It just needs to be done. We just need to come in and actually do it.
Ah, okay, very good. And then what is the latest with the mammogram recommendations after a COVID vaccine and COVID disease? Remember, we were hearing about a lot more lymph nodes inflammation after COVID vaccine or disease. And in the beginning, they were recommending to hold your mammogram for a month. What is the update on that?
I don't have that in front of me, but there is a delay, but you should still get it done after.
Correct.
So after the time that you would call the radiology center that you're going to go to and
Mhm.
ask what they're asking. But yes, you're correct. There was a delay because lymph nodes were being seen that were enlarged and people were getting scared. And but now we're past that. So just contact the radiology the department where you'll be getting your scan.
Okay, very good. And then we have a another question here from Judy Dudley. Hello, ladies. Can being on progesterone therapy to prevent hot flashes increases one's chance of developing breast cancer?
So usually you're on estrogen and progesterone. So the combination, the progesterone part especially, can increase your risk.
Okay. Is that different for a synthetic progesterone versus the natural progesterone suppository?
So here are the facts. The research was done on synthetic progesterone, but if you go around the world, the majority of people who have breast cancer are getting breast cancer from their own hormones. So I know that there are communities out there that say that if you were to use bioidentical hormones, then your risk isn't higher, but your own hormones conspire against you in general to give you breast cancer. So until we have more research, I'm not going to say bioidenticals are off the hook as far as causing cancer because if you go to China, if someone has breast cancer, it's going to be her own hormones that triggered it. So the WHI study did not study bioidenticals. And so for women who still have their uterus, who are taking hormones, estrogen and progesterone component increase your risk of cancer. And you can talk about it with your healthcare provider to see if there are other things that you can do. There is a company out there called Bonafide, Bonafide, that does non-hormonal therapies, but it focuses on non-hormonal therapies for women who are in their menopausal state or perimenopausal and having symptoms.
Okay. I was remembering that quote, your body will conspire against you. Um, Dr. Walsh was always
Oh,
making that same.
yes,
Um,
I've heard him say that. Yeah.
yes. So I'm wondering then we need to really increase how we're eating and our exercise, our healthy lifestyle
Yes.
in order to assist our body not to conspire against
Mhm.
us and to help it to fight off these cancers. So definitely. So thank you so much. Now here's another question. How effective are thermograms for breast cancer detection?
Okay, so thermograms are used by many people, especially in the holistic community, because they're concerned about the exposure to mammograms. Okay, X-ray exposure from the mammograms. Thermograms can pick up tumors by sensing an increase in heat or tissue development. So that's how so thermo meaning temperature, gram taking a picture of an increase in cell growth or development. So thermograms can be used. However, the reason why mammograms still trump the thermogram is because a mammogram can pick up cancer for the most part, for most cancers, before they're even detectable by palpation or by palpation. So with the
Mhm.
thermogram, you're going to, yes, get it, but the mass is larger by the time you get the thermogram.
Oh, I see. So then the screening mammograms are more definitive and catch the breast
Earlier.
cancer much earlier than the thermograms would.
Yes.
Okay, very good. And then here's another question. She says, I don't want radiation of the mammogram. Can I only do a breast ultrasound for my breast cancer screenings?
So the the answer is no. It's ideally you need the mammogram because the mammogram can pick up a mass before it's palpable and
Mhm.
before it's visible. So the ultrasound helps the mammogram. They work together, but this ultrasound cannot replace the mammogram.
Oh, excellent. Thank you for clearing that up because we do get a lot of those
Yes,
questions, right?
even in the office it happens. And so respectfully, so if I were to have a patient who really refuses to have the mammogram, I don't argue and I will go ahead and order the ultrasound, but just give you information to let you know this is why we're recommending this, and we go from there.
Would the ultrasound be similar to the thermograms and only pick up large items as well?
Similar but different, because ultrasound is more beneficial for letting us know is something cystic or solid. So with the thermogram, so yeah, they're different. That's the best way I can say it. They're different. Thermogram is heat sensitive. The ultrasound, you would be further along before detecting what
Mhm.
the mammogram can detect.
Much earlier. So the mammogram still
Still
remains
goes, yeah,
the one that will detect something much smaller, much earlier
earlier.
than either a thermogram or a breast ultrasound. Is
Yes,
that about right?
that's
Okay,
about right.
excellent. Thank you. And then breastfeeding. So does breastfeeding decrease the incidence of breast cancer?
Yes, it does.
Really?
It does. And having your children before age 30, but once again, you can't control
Right? You can't
when that
control those
happens.
things.
Yes.
Right. Also, that's good to know. So there a length of time for breastfeeding? Like some people want to breastfeed 2 months. Is 1 year better?
1
15
year is always
months?
better, but once again, you can't control what happens in your life, and 2 months may be all that you can do. It's still better than nothing, but
Mhm.
ideally 1 year.
Oh, excellent. Very good. And then the question about the bras. So, do underwires in your bra cause an increased risk of breast cancer?
No, they do not, but they are uncomfortable.
Yes,
There are lots of bras out there now that don't use underwire.
exactly. Yes, I was remembering we had a whole community that was talking against the bra, using a bra or the underwires in the bra because they would cause the masses that would then turn into cancer, and that was their thought on that. So
But
no, then.
just just be comfortable. We're sports bras. I don't. You don't. Yeah.
Exactly. All right, so we're coming down. Let's see, we have another question here from Miss Fada. What percentage of men would you say have breast cancer?
I had it at the bottom of one of my slides. It's a very less than 5%. I don't have that in front of me. I don't take care of men, so but hopefully.
I
Uh,
see.
so it's a small number because I think only about 400 and something of them die a year from breast
Mhm.
cancer.
Oh, that's nice. That's
Yeah,
that's pretty good.
yeah. So that is what
Okay.
I remember.
So one
But
question on that. So if there's a family history of a man with a breast cancer, does that change the females in his family for their risk of breast cancer?
that's a good question. I don't know because I honestly never thought of it from a male's perspective, but he's a first degree relative. So, first degree relative off the bat makes you have to basically get test tested in
Mhm.
general. So, him having it most likely will automatically trigger the doctor to do a genetic test to see if he has something that his offspring need to be tested for. But first degree relatives, whether it's your mother, your father, or your sister or brother, triggers your need to be more vigilant about testing for yourself.
Okay. And this is that the same for our cousins, our aunts that have had breast cancer? Like say we have three aunts with breast cancer. Do do we change how we screen for breast cancer?
So if you have two or more family members on the same side with it, then that also increases your risk. So you would have to also use the 10-year rule just to see how it's going to affect you. Because if you have two aunts with it and your mom hasn't been affected, it doesn't mean that she's not going to be affected. So you just have to make sure that you know your risk and get tested.
Okay. And
Screened, I
if
should say. Screened.
screened, yes. And so if those relatives are on the father's side,
Same
is
thing.
same thing, no
Same thing.
difference. Okay, very good. So excellent. So we're moving along here. And what about risk factors for breast cancer? I think you had gone over that. So she's asking, what are my risk factors for breast cancer?
So number one, being a woman. Number two, getting older. Number three, uh, obesity. So if your BMI is 30 and greater, whatever that may be, your alcohol consumption increases your risk. Those
Mhm,
are those are some of the risks,
mhm.
leading risk factors.
Okay. And if I remember correctly, the alcohol consumption is that two drinks for a woman? Was that the
Actually, there's
limit?
data that says it doesn't matter.
Really? Whether it's
Really,
one drink or two?
really, because so it doesn't matter. So if you're someone who's consuming a high amount of alcohol, you really should, the recommendation is to cut back, but ideally just don't have any at all.
Yes, because we had that a lot of women that started drinking the red wine because they
Wine.
said it was good for the heart. And so now
Right.
they're drinking one, two, three glasses of wine every night.
And this is I remember that study that came out, but at the same time that the substance that they're using is also in grapes. So you can eat the grapes because increase what is I would use imbibement, but increasing your drinking of alcohol also increases your tummy size. So there are
Uh,
calories that are going to your waist. So it's like, and an increase in your waist size increases your risk of heart disease. So just eat some
oh,
grapes.
I see. Wow. So then,
I'm
then by
just, I'm just,
drinking,
yeah,
yeah, because then also you just said that we store our estrogen in our fat. So if we're increasing
yes,
our west side, then we're also increasing our hormones. And so
yes,
then we're leading our way straight to a time of
other
breast
problems.
cancer.
Right,
Mercy. All the things around it that they don't always say.
right.
Oh wow. So here we are. Dorothy Corley has a question here. A nurse worked at City of Hope, and she had a group of patients that went out for a steak every week. They all had breast cancer. What do we think of that, Janet? There's a lot to be said here.
As we mentioned before, a whole food plant-based diet is more beneficial because it does
Mm,
more as far as helping to scrub your body and help to prevent diabetes, colon cancer, and
mm.
what was I thinking? Controlling your blood sugar, and helping your cholesterol levels. Sorry,
No problem.
but yeah,
So,
I don't know why they would do that, but
so yes. So I'm also thinking that, with the steak, I will assume that it probably wasn't organic or so, but they're
probably
adding
not.
hormones, right? They're adding hormones to our steak. And that's why we really probably recommend to stay away from your dairy products because they do add hormones to make the cows bigger so they can produce more milk. But that also comes into you. So therefore, then you have a risk then for breast cancer. So I'm thinking of that with these ladies with their steak every night, that they're consuming quite a bit of fat,
That's
one,
quite a bit of fat. Yeah,
right? They're
yeah.
consuming quite a bit of hormones if we assume that it wasn't organic, right? And a lot of times, steak comes also with alcohol. So I'm not sure if they were also having a little bit of wine to go with their steak dinners. And then when you go to eat at a steakhouse, generally they'll have the steak and the potato, um, right? So still yet we don't have enough fiber with that meal, but they sometimes offer broccoli. And then a lot of people do not take that side of broccoli, and they might take the what is that
Corn.
salad? The corn, right? So that's not helping us right with our fiber. Or
Yeah,
they'll take the iceberg lettuce salad, which is what full of water. So then you're eating the
which is
steak.
better than just
So we're glad that
so
they had
yeah.
the salad, but it contained mostly water, so there wasn't enough fiber. So for anyone out there who's going to have a steak dinner, then we would recommend to at least, or I would recommend to at least add the broccoli side because you
Half
would
of a
have,
plate, actually. A
right.
half
So
of a
they
plate
get
of broccoli, same size as the steak,
there you
to
go.
flush the system.
Exactly. So if we combine the fiber with the fat in the steak and the hormones, then we can at least get it to go straight through your system and come out the other end. Of
Yes.
course, I just want to remind everyone that steak does take about 3 days to digest. So you might want to continue eating a lot of fiber after your steak meal. But definitely, I think our thing here is to eat enough fiber,
Right.
right? To bind with your fats, to help decrease your levels of hormones in your system, to keep your body functioning so that you'll have a healthier life and decrease your cancer risk. We also have another thought from Dorothy Corley here. Mrs. Aikens, Health Ministries at South Central Conference, said chicken that has been fed hormones to fatten them up increases cancer risk more than any meat. Any thoughts on that?
I would have to see the research on that, but it just goes back to the recommendation of a whole food plant-based diet as being something in general to protect you from the other things that are out there that are a negative influence on our health. So yes, I would have to actually look that up. It's quite
Yes.
probable and possible that this is true.
Yes, I'm remembering a little article that they had regarding the hormones that they're given to chicken now, especially I believe they were focusing on some fast food places like McDonald's and some other places that they put more hormones into that chicken also to get the chicken to grow bigger so you can have a larger breast and things like that.
Yes.
So, right. So then there again, same thing that you said, we're eating those things, right? So I think maybe one of our takeaways would be that if you choose to eat any animal product, is that your side of vegetable with it should be larger than your portion of the animal product that you're choosing to eat so that you can at least balance out what's happening. So I know that a plant-based diet is
Yes,
not
I do.
is right, is a
It's
little bit challenging.
for some people, yes.
Exactly.
Mhm.
So whatever changes that you make are always helpful, whether they're small, they're large, whether you get to make them every day, once a month, anything that you do is helpful and gets you started. And as you get started, then you'll be able to keep going and going. And next thing you know, you will not be having as many meat products out there because, honestly, the industry does have to sell their product,
They
right?
do.
And so if it is dry and it's hard and it's small, I don't think a lot of people are going to want to eat any type of chicken that looks like that
Mhm.
or red meat that looks like that. So they do need to help their chickens get bigger and juicier, but that will kill us off much earlier.
So
I said that kind of strongly, didn't I?
it's fine. So just a few things. So with the fiber consumption, think of it this way. When we have fiber, fiber is just toilet paper. The to- I just fiber is just I looked at the comments, someone is also not plant-based, yes. So fiber is just toilet paper in your system. Think of it that way. So when you have fiber, you must have an increased amount of water to flush the system because when you have a lot of fiber and not enough water, you become bloated and gassy and you don't feel good. And you're thinking, I'm eating fiber, so what's wrong? Why am I not doing better? It's because you need the water to flush the system. So because the fiber is just sitting there pulling everything off and you're getting gassy and bloaty.
Oh, I see. And what's the recommendation now regarding how much water we should be drinking?
So I just tell patients I'm trying to make this is what I tell my patients just in case they find this link. So I tell them to look at their urine. Your kidneys are a good barometer of what's going on in your body. If your urine is pale and almost see through, you are hydrated. If your urine looks like apple juice or anything close to apple juice or Sunny Delight, you need more water. So you keep drinking until your urine is pale. Because for me, I may have 10 glasses and I'm perfectly fine, but you may have to have 20 glasses. Everyone's body is different. Just
Mhm.
stay hydrated. Listen to your kidneys. They won't deceive you.
Right, they'll send you straight. That's excellent, excellent. And then we have a question here from Francis Parker. Sorry, uh, fairly off the subject. Your take on the correlation between estrogen and arthritis?
So here's what I can tell you. We have estrogen, progesterone, we have receptors throughout our body. And so as we get older, the estrogen, progesterone receptors on your scalp, they start to not function, so our hair thins. You have estrogen receptors throughout your body in your muscle system, and so as you start to go into menopause, because your estrogen progesterone production is going down, you move less, and you have to basically fight what nature is trying to do. Your nature is trying to replace your muscle with fat, and so you're moving less. So what's going to happen? You're going to put on the fat. Same thing in your joints. You have receptors there, so you have to just keep moving. And unfortunately, yes, some of us will develop arthritis. Arthritis is a product of aging. So I would say if you're someone who feels that you need to use estrogen because your joints are really uncomfortable and you're not functioning, then go ahead. But in general, just try to keep moving as best as you can for as long as you can until you can't.
Okay, excellent, excellent. Definitely, we want to keep moving. And isn't that one of the secrets to a healthy lifestyle is to move every day,
Yes.
right? Keep walking because I believe if I remember right, that also balances out our hormones if we're having exercise, daily exercise.
Exercise is actually, I wouldn't say balancing, it's good for everything overall because it
Mhm.
releases your feel good hormones. So in general, you feel great after you exercise. Initially, you may feel like, I don't want to get up, but once you do it, you're like, I did it, and you feel great. And you
Right?
feel better about yourself. Exercise helps to decrease Alzheimer's because you're increasing the circulation of blood flow to your brain. So exercise is good for lots of things. It helps us keep your skin tight. So it's good for your heart. So exercise.
Oh, definitely. Yes. And then I just had another question here regarding sugar. Now, how does is it true that sugar increases hot flashes?
I haven't heard that one. I haven't heard that one. I wouldn't be surprised because sugar does lots of things. I would have to honestly look that up. I don't want to make
Hmm.
anything up because that is off the beaten path a little bit. I didn't. Yeah.
Hmm. No problem. Yes, because I know sometimes, we like to get our sugar, but I'm wondering if sometimes the things that we eat is sugar and fat combined,
Right.
you know, uh, like for me, I love my donuts, right? So by
They
then
don't like you though.
they don't. They're so mean. They keep
They are.
conspiring to kill me.
Really.
So I've had to say no. So I'm glad to report, for those who saw the last presentation with Dr. Wash and me and my donuts. I haven't had a donut since, so I'm going on a
Excellent.
few months donut free. But yes, that's what I'm thinking then, that there's sugar with the fat in the donut, and those will cause, your body to dysfunction, like that. But we want to thank you so much for coming on and
Thanks for
helping
having
us.
me.
Yes, no problem, with our breast cancer awareness. We definitely, encourage everybody to go back and watch it, to share it on your social media platforms, to relook at those myths. Because you know how it is, ladies and gentlemen, when you're in conversation with each other, somebody will say, "Hey, I'm not going to go get a mammogram and get radiated, and that's going to cause my breast cancer." Or often, we hear the one, if I get the breast cancer, they press so hard that they spread the cancer that's
Right.
already there. And I believe, actually, on that point, though, some of these new mammogram machines do not actually press as hard as the old ones. So that breast, screening experience is much more pleasant than before. So I would definitely encourage you to go and get screened. It's not as painful as it was. And I'm not sure if Dr. Longo would agree with me. Sometimes the pain is worth knowing early enough so that you can make a change in your lifestyle and get treated earlier.
I agree.
Right. So we want to thank everyone so much for being with us. We want to do a shout out here to Candace, who joined us here, Fada as well, and Dr. Parker. We thank you all so much, and we'll see you next time for supporting a healthy lifestyle.
Bye.
Bye. But this was really good. Let me find my thing here. And then